Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined by Bart Charlow, who is the CEO of Samaritan House. Bart, welcome.
Hi.
I should say welcome again. So let's talk about Samaritan House. We did a segment a bit ago about Samaritan House, and we also have done a segment with regard to the food pharmacy at Samaritan House. But it's almost like there's a new Samaritan House today, because as our wealth gap increases here in San Mateo County, we all know that we're creating some of the wealthiest individuals in the nation based on our tech sector, our biotech sector. But we're also creating now a larger gap between our low-income community and our wealthiest of wealthy.
Yes.
So I am imagining that Samaritan House has really evolved over the decades that you've been providing service. So tell us a little bit about that evolution and what you look like today.
Well, the evolution, really, we are truly a volunteer community agency. It's about 2,600 volunteers, not counting the thousands of children in our We Care program in the schools, who are just professionally organized by a small group of regular staff. But we originally began by people handing out sandwiches, for example, in the parks, and that's still a part of what we do. Dani, we have never lost that culture of caring about individuals, of bringing back their dignity.
The simple act of giving people food.
Yes, yes. So it's food, shelter, clothing, healthcare, financial empowerment, all kinds of services that we do. And it's vital today because we're creating more poverty as we're creating more wealth. We're all living in the same place with a limited amount of housing. Somebody's got to live somewhere. So if it's all going to those with wealth, then those who have none have no place to live or no place to eat. But they still need to work, and we need them working here.
So what would you say is the greatest sort of change that you've seen, and let's say even say in the last 5 years, with regard to Samaritan House and some of the delivery of services to the individuals?
I would say that we've expanded our medical services in new ways. We're just adding some mental health services, things like the food pharmacy we just spoke about. We're getting more creative with our limited shelter space. You know, we run the homeless shelter up near the airport, and we are creating things such as, for example, we have the first medical respite beds in San Mateo County. So folks who are discharged from the hospital who would otherwise be homeless but still need time to heal can get the kind of care they need while they're at our shelter. We do all sorts of different things in the schools in teaching children the lessons of empathy. It used to be that, you know, all of these schools had the barrels for donations, and your kids, everybody's kids, would give to that every month, and that was wonderful. It helped us to stock our kids' closet, for example. But now we're actually having classes of children come through and take real lessons in what it means. What are your stereotypes about people who are less fortunate than you, sometimes in their own classroom? And it's just astonishing to see the change in people's attitudes once they understand. We're doing many different things in the way we deliver food. We delivered over 900,000 meals last year. We're getting closer to 1 million this year. So we reopened the dining room. We're opening school pantry operations. We get out to senior centers. We get out to after-school programs and give the kids snacks so they have something in their brain, you know, when they want to do their homework. We have mobile meals, which goes to seniors and shut-ins. All sorts of things we've been doing.
So you've got to be a fairly sophisticated organization with regard to either technology or the services that you provide, because as need is growing, and need changes, right? Over decades, the needs will change and communities will change. You have to be remain relevant, and you have to remain innovative and swiftly act to then meet these ever-changing needs of individuals and families, et cetera, and even seniors now.
Yes.
Which, you know, is now a new population that is now needing all of these services from
that
shelter.
About a quarter of the people I find in our shelter are seniors, and they're out on the streets for the first time in their lives only because they're living on fixed incomes and can't pay rent here. And these are the people who built our community.
Right.
So these are the sorts of things we are dealing with, Dani, but it's not so much a matter of sophistication as it is organizing people. We start with the heart. People's hands are in this by the thousands, and then we move it out in an organized fashion to meet the need as we see. We're very flexible. A part of that flexibility comes from the fact that we are primarily funded by the community. We're not a government agency.
Right.
So 70% of what it costs to run this agency every year, we're getting from individual contributions, our main event, which you know about. People in the community are giving us their hands, and they're giving us their pockets, and they're giving us their hearts. We know how to put that together and make it work.
So we could really take a page out of your playbook in how you create partnerships and how you utilize your community to bring services together, because it's not something that you just do alone. The food pharmacy is a prime example. Tell us a little bit about that and some of the results that you're seeing from this partnership with Second Harvest Food Bank.
Well, Second Harvest is our big partner. We're their big partner in this county for delivering food, you know, that truck-to-table need, the last mile. And they're wonderfully progressive. They really think ahead in terms of what people need and how better to serve it. And we've got the manpower to do it. We've got the organization to deliver it. So
and you have the clients that need it.
And we have the clients that need it. There are more clients than we could ever get to that need it. So this is the way you do it. So food pharmacy involves our doctors, our medical staff, our case management staff, their food, and funding from the community, agencies such as Sequoia Healthcare District, making this possible. And putting that all together as a cooperative venture did something that nobody was doing before.
And I was even surprised to learn about it. It seems like it's a fairly novel, I mean, not a novel concept, it'd be regular concept of eating the right foods to prevent disease and or support health. So again, go into a little bit of detail how this food pharmacy is very specific to disease diagnosis.
Okay, well, we're concentrating these days on diabetes type 2, which is the most prevalent diagnosis in the United States.
And heart disease even.
Yes. And what we're finding is that by coupling the behavior change and the food that we have in this food pharmacy program, we're able to lower A1C and lower weight to the degree that we are doubling the impact people get from medication alone. That is extremely profound in medical terms.
I think you need to say that one more time because...
Doubling the impact. And here's what it means in real terms. You got a 21% reduction in diabetes-related deaths. Nobody wants to die of this stuff. You got a 45% reduction in cardiovascular deaths that occur because of the complications of diabetes. Those are extremely profound. Drug companies spend God knows how many billions to try and get results even near that. And this is done with food with no side effects.
Right. And I think even the numbers are even greater when you take death out of the equation. It's even not reoccurrence, but quality of life and health issues. So as we know with diabetes, the loss of limbs can be an end result.
Loss of eyesight.
Eyesight.
Yeah.
All sorts of other that would prevent you from being employed, that would prevent you from, and now you have ways to say, we can help manage this whole progression.
We can, and we're doing it for the whole family at the time, not just the patient. So it's having impact on multiple generations. It's a profound idea, profoundly simple, but it works incredibly well.
I understand you also to the first partnership in I think the Western United States. It's even trying something like this.
let's just take it to California. It's the first 2 food pharmacies in the state of California. I hope others will replicate it. The need is all over the place. It's a great program.
And even from the private sector. So it's not just clinics, free clinics. It should be all clinics that have, this accessible food available to them. We find that it's that last mile that you talk about, even in regular medical clinics where the doctor is talking about a healthy diet to support their health or disease prevention. And it just doesn't end up being executed at the end of the day because perhaps grocery stores are too far away or the fresh fruits and vegetables are too expensive, et cetera. So I love the idea.
When I go to my dentist, okay, I leave and they have a little packet for me, with a toothbrush and toothpaste. Someday they'll have a broccoli for you.
When you leave.
But that'll be terrific.
Yeah. Well, Bart, we have just about a minute left. So
Sure.
there's so much that's happening at Samaritan House and so many of the services that you're providing. What's that last thing that you want to tell our viewers before we have to say goodbye?
I want to share something with you that happened to me yesterday.
Okay.
A couple came in to donate a whole bunch of clothes, children's clothing, that their children didn't need. And they stopped me and said, we're giving this to you because we know what it means. You helped us with our family when we were out of luck. You fed us. You got us this clothing for our children. You even helped us pay the rent. we're okay now, so we want to give back. And that, to me, says the whole story.
Paying it forward. Thank you, Bart, for sharing that story with us, and thanks so much for all you do within Samaritan House. And we'll see all of you next time on Penn Voice.